3 billion people across the developing world still rely on wood, charcoal and kerosene for their everyday cooking. The resulting household air pollution remains one of the world's greatest environmental health challenges, responsible for some 3 million deaths each year from respiratory and cardiovascular diseases, stroke and cancer in adults, and pneumonia in children. Here at the University of Liverpool, our NIHR Clean Air Africa Global Health Research Group is working with the World Health Organization to support rapid scale-up of clean household energy, such as liquefied petroleum gas and electricity. Clean Air Africa is providing policy-relevant evidence for governments committed to helping their populations switch away from polluting fuels. In terms of clean fuel options, our studies show LPG has the best potential for scale-up, will yield big health gains, and despite being a fossil fuel, is neutral in terms of climate impact. Among the barriers to change, our work has identified affordability as key. For LPG, this includes upfront equipment costs as well as the large outlay on cylinder refills, which is a problem for those households used to buying small quantities of charcoal or kerosene. Pay-as-you-go LPG is an innovative solution to these barriers that is gaining ground in East Africa. For example, Pay-go Energy in Kenya provides the cooker and bottle, while a smart meter allows customers to buy the amounts they can afford using mobile money. The meter displays credit for the user and is networked to the supplier, who arranges delivery of a new cylinder when the level is low. Circle Gas, known locally as M-Gas, is another East African provider which employs smart meter and mobile technology. Clean Air Africa will be evaluating scale-up, looking at use, health and gender impacts as well as costs. We are working with the Kenyan Ministry of Health to address household air pollution at a population level. Dr. James Matari, Chair of the Ministry's Technical Working Group, explains the role that community health workers can play.
A community health worker is attached to a household, and we have community health workers all over the country. And the country has also committed to make sure every community unit has adequate community health volunteers. They are very good in promoting health service, preventive health services at the community. We felt this was the best vehicle to use so that we can reduce household air pollution. But it cannot also happen unless they are also trained.
Clean Air Africa has helped the Ministry develop a national training programme covering health risks, options for clean cooking, lighting and heating, including the testing of improved cook stoves, and measurement of air pollution.
The concentration of
The training will be delivered to the 100,000 strong community health workforce across all 47 counties starting later this year. UN Sustainable Development Goal 7 seeks to ensure access to affordable, reliable, sustainable and modern energy for all by 2030. On current trends, Africa will not reach this milestone. Further development of evidence-based policy and appropriate levels of investment are urgently needed if these stark inequalities in energy poverty are to be addressed.